Greetings, everybody. It's Dr. Charles Modlin, your friendly urologist. I'm back with another health equity brief for the month of February, but you can use this information throughout the year. Spread the word, like, subscribe, share. Let's get this information to go viral. These health equity briefs, again, are opportunities for me to present to you, the listening audience, important information that I believe is important for you to maintain and improve your health, that of your family, as well as that of your community. So today I'm going to talk, again, very briefly about prostate cancer. I am a urologist. A urologist is a surgical subspecialist who addresses genitourinary disorders in males, also urinary system disorders in females. That includes addressing issues such as kidney stones, kidney cancer, bladder cancer, prostate cancer, urinary tract infections, and other situations. So today I'm talking about prostate cancer. Prostate cancer afflicts twice as often black men as their white male counterparts. Twice as many black men develop prostate cancer, and twice as many black men die from prostate cancer compared to their white male counterparts. If we can diagnose and treat prostate cancer in early stages, we can get almost identical survival rates. So that excessive death rate from prostate cancer in black men is not necessarily necessary. A lot of that is related to later stage presentation of prostate cancer in black men. We made some recent strides in terms of raising awareness about the importance of preventative screenings for prostate cancer in black male populations, but there's much more work to be done. It's a very simple way in which we screen for prostate cancer nowadays. In the old days, we would always have to do a digital rectal examination. A lot of men, black, white, whomever, were fearful of coming in to get that examination. Nowadays, the vast majority of cases, we can screen with a simple blood test called a PSA. That's called a prostate-specific antigen simple blood test. Urologists are expert in terms of interpreting the significance of a given PSA for a given man. There's not a one-size-fits-all approach for every man in terms of what is normal for that individual. In general, the age, the decade of life in which an individual is living determines what the upper limit of normal for a PSA is, especially in black men. Recommendation in terms of when to start screening is that African-American black men should start screening for prostate cancer at the age of 40 years old. In contrast, white men don't have to start screening until the age of 55 unless they themselves have a strong family history of prostate cancer. The reason black men need to start screening 15 years earlier, again, is because the higher incidence, higher death rate from prostate cancer in black men. There are some studies that show that prostate cancer may be more aggressive in black men versus white men. There are various treatments for prostate cancer. The good news is that nowadays, depending on the type of prostate cancer, the grade of prostate cancer, not all cases of localized prostate cancer need to be treated. There's something called a Gleason scoring system, grading system, that the pathologist uses to interpret the level of aggressiveness, the potential that a given prostate cancer will grow in a person's lifetime and spread. So that scoring system, it's called the Gleason scoring system, goes from 6 to 10. The good news is that a lot of men who have low grade, which would be 6 or 7 prostate cancer, don't necessarily automatically need to be treated for that prostate cancer, and the treatments would consist of radiation or surgery. But again, some men can be treated with, we call it surveillance, watchful waiting. Again, all of this has to be individualized according to the individual patient. There's no one cookbook approach. Again, treatment for localized prostate cancer could be surveillance, where we repeat the PSA, the blood test, every 3 to 6 months, depending on the individual circumstances. Radiation is one form of treatment. There's different types of radiation: external radiation, brachytherapy, or seeds. And then there's something called robotic radical prostatectomy. That's a surgical treatment. But at any rate, the main message I want to relay to you today is prostate cancer is potentially 100% curable, even in African Americans. It's very important to get screened, know when to start getting screened, follow up with your PSA. And again, I always say every man needs a urologist in addition to a primary care provider. Urologists, again, are surgical subspecialists. In the case of prostate cancer, we are the specialists who have expertise in terms of screening for prostate cancer and interpreting individuals' PSA results, etc. That's my health equity brief for today, and tune in for another topic tomorrow. Thank you for being with me. Thank you.